Chapter 9. Trading Deformity for Dysfunction. A crossroads for every family. Every year, thousands of families sit in a doctor's office, staring at an X-ray that shows a spine bending like a question mark. The big question is, what should we do next? For decades, the most common answer was, schedule spinal fusion. Yet the latest research makes that answer far less certain. Most adolescent idiopathic scoliosis, AIS, curves do not threaten life or lung function, and modern studies find only limited proof that fusion is truly needed for the majority of cases. At the same time, the surgery carries real risk, hardware failure, infections, and the chance of extra operations that can end up hurting more than the curve itself. When we weigh those facts against new, whole-body programs such as ScoliSMART Reflexive-Response training, Schroth-based exercises, scoliosis-smart yoga or Pilates, and metabolic support, the safer road often points toward active, non-surgical care. What the literature really says. Many people are surprised to learn that no long-term, prospective, controlled trial has proved fusion is better than simply watching a curve and using modern exercises. Reviews like those by Westrick and Ward, and Weiss and Goodall, show that while fusion can make an X-ray look straighter, it does not always improve pain, lung power, or daily function over the long run. Even curves larger than 80 degrees sometimes cause only mild limits if a person stays strong and flexible. This gap in hard evidence should make every parent and doctor pause. If the science has not confirmed that fusion is strictly necessary for most AIS curves, why rush into a procedure that cannot be undone? The hidden weight of complications. Fusion is not a single event. It is a chain reaction. Rods and screws may break or loosen, bone may not fuse solid, called pseudoarthrosis, and nearby joints may wear out faster because they have to bend more. These issues can drive patients back for revision surgeries, sometimes 2 or 3 times over a lifetime. Research places the 10-year revision risk between 15 and 25%. Infections add another layer of worry. Deep hardware infections can linger for months and may need long hospital stays with strong antibiotics. Each extra surgery brings new costs, more time off school or work, and fresh hits to a teenager's confidence. When you add up these burdens, the overall complication weight can eclipse the natural risks of living with an unfused curve. Growth-friendly constructs. High hopes, higher stakes. For very young children, or those with neuromuscular conditions, surgeons sometimes recommend growth-friendly constructs like growing rods, adjustable surgical devices, or spinal tethering. These systems aim to guide the spine while allowing it to lengthen. Yet, they often require a series of expansions or adjustments, meaning many trips back to the operating room. Infection rates are higher in small bodies, and hardware fatigue is common because the implants must survive years of kicking, jumping, and growth spurts. Some studies report complication rates above 50% in these cases. Parents need clear facts. While the idea of fixing the curve early feels comforting, the price can be a childhood marked by repeated surgeries and long recoveries. A lifelong view of scoliosis. Scoliosis does not vanish when the brace comes off or the surgical scar heals. It is a lifelong condition that needs regular checkups, daily posture habits, and ongoing core strength. That truth undercuts the argument that fusion offers a one-and-done cure. Yes, the curve may stop moving, but stiffness, pain above or below the fused area, and worries about hardware remain. Non-surgical care takes a different path. It accepts that the spine will always need support, so it teaches lasting skills, strong muscles, balanced reflexes, and healthy tissue chemistry that a person can use for life. Integrative, patient-centered programs. ScoliSMART Reflexive-Response Rehabilitation uses a light suit and short boot camps to train the brain's balance systems. The suit's gentle resistance reminds muscles to fire evenly each time the wearer moves. Over months of practice, the new pattern becomes automatic, like riding a bike. Schroth PSSE, Physiotherapeutic Scoliosis-Specific Exercises, delivers custom positions and breathing drills that lengthen tight sides, strengthen weak ones, and expand collapsed ribs. Studies show real gains in cob angles and life quality when these exercises are done 4 to 5 times a week. Movement therapeutics, ScoliosisSMART yoga, Pilates, and balance board drills add variety and fun while deepening core control. These lessons teach teens to sense and correct asymmetry as they play sports, dance, or sit at a desk. Point 5. Metabolic optimization brings lab science into the plan. Testing neurotransmitters, hormones, and gene variants can uncover low serotonin, vitamin D gaps, or weak collagen genes. Targeted nutrients and lifestyle tweaks then shore up bones and soft tissue from within. Together, these tools make a flexible toolbox that adapts as a child grows and as an adult faces new challenges like pregnancy, desk jobs, or middle-age weight gain. Real-world wins without rods. Stories from clinics around the world back up the data. A teenager with a 40-degree lumbar curve joins a ScoliSMART boot camp, continues Schroth at home, and sees her curve drop to 34 degrees over 2 years while playing soccer pain-free. A 12-year-old boy with a 50-degree thoracic bend partners with a scoliosis-aware yoga instructor. By high school graduation, his curve is stable, he can touch his toes with ease, and he makes the swim team. An adult in her 40s, long past growth, uses metabolic support and Pilates to ease chronic back pain, and sees her curve hold steady for a decade without surgery. These cases are not miracles. They are examples of what can happen when the body, brain, and chemistry all pull in the same direction. The ethical edge. Medicine's first rule is do no harm. When a treatment offers clear, proven benefits, its risks are easier to accept. But when benefits remain unproven or modest, exposing kids to high complication odds tips into ethical gray territory. Is it right to lock a growing spine with metal and bone grafts and to accept a 1 in 4 chance of more surgeries within 10 years if a person could likely enjoy a normal lifespan with active, non-surgical care? Most ethicists would say no, especially when less invasive choices carry low risk and leave future options open. Costs that keep climbing. Financial weight matters too. A single fusion in the United States can top $100,000. Add revision surgeries, physical therapy, and missed work days, and the lifetime bill can soar past $250,000. Non-surgical programs cost far less up front, often a few $1,000s for an intensive camp, plus yearly tune-ups. And families can pause or scale back if money gets tight. Insurance plans are starting to notice these savings, with some now covering Schroth and metabolic testing. As healthcare budgets tighten, paths that achieve good results for fewer dollars will draw more support. What we still need to learn. The debate will never settle without head-to-head trials that follow large groups of similar patients for at least 10 years. One half would receive best practice fusion. The other half would get an integrated program of PSSE, movement therapy, and metabolic care. Researchers would track not only x-rays, but also lung power, back strength, school attendance, sports participation, and mental health. Until such studies are done, and until implant registries log every screw, rod, and late infection, the claim that fusion is the gold standard remains an opinion, not a proven fact. A parent's checklist for wise choices. Read the research. Ask for studies longer than 5 years and look for quality of life outcomes, not just cob angles. Demand full risk numbers. How many of the surgeon's patients needed a revision? What was the infection rate? Explore non-surgical clinics. Visit at least one center that offers ScoliSMART, Schroth, or similar methods. Consider lifestyle fit. Can your child commit to daily exercises? Would repeated surgeries disrupt school, sports, or friendships more? Plan for the long haul. Scoliosis care will be part of life for years. Choose a path that feels sustainable in time, money, and mindset. Bottom line, the safer, smarter choice. Given the current evidence, spinal fusion should be reserved for truly severe, fast-moving curves that threaten vital functions or that do not respond to well-run, non-surgical programs. For most AIS cases, especially those under 60 degrees, families deserve to know that skipping surgery and embracing comprehensive, whole-body care may be the safer, smarter choice. Non-surgical methods respect the spine's natural ability to adapt, avoid the high stakes of hardware, and teach lifelong habits that support health well beyond the teen years. Until robust comparative trials prove fusion delivers clear, superior benefits in comfort, function, and quality of life, the gentler road remains not only reasonable, but, for many, the best road forward.